Well, welcome everyone to our quarterly meeting. It's good to have everybody online. I know others will join as they're able. We have a very full agenda this evening, and so we're going to just keep it going so that we can get through all of the items that we have tonight. We will have health department updates. We're going to meet our new and welcome our new health officer. We'll also share the health action, our coalition action items, and our work group leaders will present on, specific activities that they're doing and the intended outcomes of those things. And then we'll give introductions. Dr. Carter will give introductions to the CCCT and then questions and adjourn. So without further ado, let's move on to our first update from Olo, our Deputy Health Officer.
Oh, no icebreaker?
No, sir. Icebreaker. We already did that. It was changing you didn't do it because your name is still Kim. So the icebreaker was change your name on your caption there.
Okay, sounds good. My name is Ololade. I go by Olo. I had that nickname since the seventh grade. I'm the deputy health officer here at the Prince George's County Health Department. I've been at the health department now for I think just over 2.5 years. And I just want to talk to you a little bit about where the health department is going to be going in the future. So for and maybe I'll give an illustration. I think where the health department is heading, and where I guess where most health departments have been at before, has been in what was termed public health 2.0, and that's really where the health department was out in the community doing direct services, lots of delivering direct services, immunizations, doing home visits, doing a lot of work. That was kind of the graduation from public health 1.0, where we were really talking about some basic public health, having clean water, clean air, clean environments, taking basic public health precautions. And public health 3.0 is looking at a different model. And that's kind of what I want to talk about a little bit today and where the health department is going to go. And I really felt the biggest need for public health 3.0 during COVID. And I remember it was a conversation that I was having with the county chief administrative officer, where we were looking at our immunization rates for COVID. And we've done a lot of work at the health department to be able to improve our capacity for doing immunization. We built and set up, 7 vaccination sites at one point, and we were pretty proud of the level of capacity that we could get to. Even the governor came down. The governor on his news announcements was saying how great of a job Prince George's County was doing, and the health department was doing a great job. But then this chief administrative officer asked me, well, where do we need to be? And so I drew a graph that looked at all of our capacity. When we maxed out capacity at the health department, we started here and we went all the way up here over the course of 4 or 5 months. But when we looked at the goals that we needed to be at in the community, it wasn't right here. It was all the way, way, way up here. So there was this gap in the middle, that no matter how much capacity the health department built, we couldn't fill that gap in the necessary time that it would take to fill that gap. And that's when we had to develop a different strategy for ourselves. We had to really realize that the real weight of the issues that are in the community really can't be solved by just the health department. We had to reach out and we had to partner with others. We had to go and partner with healthcare providers, FQHCs, pharmacies, various other places. And that's a lot of how we were able to start to kind of make that gap a lot less of a gap. And to really, really close that gap when we really started to work and partner and see the health department as not necessarily the one who has to do everything, but really as a focal point within the community. Someone who takes the role of figuring out, hey, helping us all figure out this is where we want to go, this is where we need to go, and building spaces where we can work collaboratively towards those goals. I think, this coalition is a part of that long-term vision of the health department. And it's a strategic issue that we have. Strategically, we can't get to these goals of better of health equity, of better mental health, behavioral health. We can't get to these goals alone as a health department. We really have to get to those goals as a community. That's the only way we can do it, is kind of working together. And so that's really what Public Health 3.0 really is. It's about the health department as a connector, the health department as helping folks connect, helping folks communicate, helping folks develop a shared agenda, a shared goal, and then building a space where we work on these goals together. And that's a lot of where the health department is going to have to focus. It's going to be a change for lots of us who, when we are used to working in a specific way, it's going to be a hard transition. It's similar to when folks just went from being an individual contributor to going into a leadership or management role. Lots of folks didn't realize the transition that they were making. That this is essentially a different job, that you have to value different things. It's not about what I can contribute. It's how do I bring out the best in this team? How do I teach? How do I train? In that way, the health department is going to have to go through this kind of learning process, this change process, if we are truly going to be able to make this transition. Because I've been in a lot of change situations, and the ones that are successful are the ones where folks realize that everybody here has to change if we want to see this change. It can't be like, oh, I want to see this change. Oh, well, that means that you need to make this change. We all have to make this change together and learn how to work with each other differently in order to make this work out. So that is the future of public health. And that leads us into accreditation, because the accreditation process is really what is going to allow us to chart that road to Public Health 3.0. We're going to be looking at developing a strategic plan, a health improvement plan, a quality improvement plan, documenting policies and procedures. It's going to be a very, very large undertaking, and it's going to be something that's also going to involve folks that I see in the room here, because this is not a health department plan. It is a public health improvement plan. It's not a health department plan. It is a public health improvement plan, and it has to involve not only the health department, but all these players that have a role to play in this. So I bring this up in this group to say, expect it to come down fairly soon next year, that we're going to be embarking on this process. It is not going to be an easy process. It is going to be a multi-year process. Even for us to apply for accreditation, it's probably going to take a couple of years for us to do all the activities and get ready and have all the conversations and all the interactions. So I want you all to be ready for that, because it won't be easy, but it will be a valuable thing when we can all be in the same room together and know that all of our initiatives are aligned towards these goals that we have for each other, and that we're all working together towards this goal. So I look forward to the process. I honestly do. I think we're going to get a lot out of this process. Yeah, get ready. But anyway, thank you. That's all I got.
Thank you so much, Olo.
No problem.
Okay. All right. Next we have our own new health officer. We're so excited about Dr. Levy being with us and coming from just a very eclectic background, not just in his own experience as a physician, but also in policy and in research and guidance and at the state levels and various different, kind of sectors, which I think is very, very interesting. And he'll bring all of these tools and his ginormous tool bag to our county. And so we are excited to have him as our health officer, but also as our co-chair of this coalition. So without further ado, Dr. Levy is going to introduce himself and give you a snapshot of who he is and where he hails from.
Good to start off on you. That's really important. So I'm Matt Levy. I'm the new acting health officer. I have yet to be confirmed by the county council, but hopefully that will be an opportunity to go in front of them and talk about the great things that the county's already done and the great things that we will do. And I just want to echo what Olo said, and that I support him and the department in its vision of trying to be a collaborator. And throughout my career, I have collaborated across systems and tried to break down silos of care. And this group is a perfect example of that. I started my career at Georgetown as a fellow in community pediatrics and child advocacy. 2 years, it was a 2-year fellowship with a master's in public health that I got at Johns Hopkins. And halfway through the program, Hoya Saxa, what rocks. Halfway through the program, the program changed hands, and I ended up finding myself as the medical director of a team of one. And over 18 years later, I built a section that improved access to care for children and families by creating programs that got out into the community and that partnered with others and collaborated on large scale population health, quality improvement strategies to change how we do things and to make them more efficient, more effective, and hopefully reach more people and get people back to health. So in order to know where we're going to go or where we want to go, we need to know where we are. So using data and using quality improvement science to really drive change. So I was at Georgetown, ran a mobile medical clinic, 2 school-based health centers, a homeless shelter clinic, a mobile nutrition program, a behavioral health program, all working together in a collaborative way, and a multidisciplinary team acting on behalf of in the best interest of the patient, with the patient as a partner. So it really was a different model back then. It's now the model we're all going to, which is a great opportunity to work together. Fast forward a little bit, and I'm now the section chief, the division chief, and I'm like, I need a break. So I took a break as a Robert Wood Johnson Health Policy Fellow, worked for Senator Conrad from North Dakota for the year, made lots of connections, and that I plan on using in this position. And then went on to work at the Bipartisan Policy Center part-time on a physical activity and nutrition initiative to kind of understand the lay of the land around healthy weight and healthy lifestyle and behaviors, and what we can do as a country to change how we approach healthy weight and how we approach lifestyle choices and really move the needle on people being healthier overall. Let's see what else. Then I ran for public office, and I was an ANC commissioner for a term and a quarter. And then I found a job in Atlanta to do large population health quality improvement projects for 900,000 children and 400 pediatricians and 800 specialists. Did that for a couple of years. Went to Wisconsin, built their division of started to build their division of community pediatrics and general pediatrics. And this job came up, and I said, you know what? Everything I've ever done in my career has led me to this point. This is an amazing opportunity to work with some great people and really try to problem solve together and drive change so that we can improve access and the overall health and well-being of the residents of Prince George's County. And I mean that from the bottom of my heart, that this is an opportunity for all of us to work together. And I'm excited to work with this group, really very excited. I keep discovering new things and new people and people that are dedicated to, that been at the Department of Health for 5, 10, 15. I just met someone today that was been there for 35 years. And clearly everybody there is dedicated to making a difference. And I hope that I can help lead the organization and also learn from everybody to be able to drive that change. And hopefully, in a few years, we'll start to really see a true impact. I don't want Prince George's County to be in the middle of the county rankings for Maryland. I want it to be number one. So, I'm not ambitious at all, and I'm not competitive whatsoever. So don't worry about that piece. I really want us to succeed, and I know that I cannot do that alone. So I'm looking forward to working with this group, learning from you, and bringing whatever knowledge I have. You're welcome. Whatever's in here, you're welcome to it, and trying to drive some change. So I'm happy to answer questions maybe at the end if there's time. I know we got a very full agenda. I'm going to listen mostly because I'm learning from everybody. This is a great group. And I want to just give a shout out to Kim and Dr. Little and Olo in particular for really, Olo's been, really trying to drive change at the Department of Health in a leadership position. And I know Dr. Little and Kim have really been trying to get us back on track and moving forward with this, with the coalition. So thank you for the opportunity to be here, and I look forward to learning from you.
Thank you so much, Dr. Levy. So we're going to move on to our action items, and I think Kim is going to review that for us.
Yes, ma'am. Thank you. And thanks again, Olo and Dr. Levy, for your words of encouragement. So a couple of things, we just want to go over a few things that we're working on as a whole coalition outside of all the work groups. So of course, everyone knows that one of the main deliverables for the coalition is the collaboration on the community health assessment and the completion of the community health improvement plan. So all of our nonprofit hospitals are required to complete the community health needs assessment every 3 years. In the past, we've been collaborating. We as a health department have collaborated with our hospitals to make sure this document is completed as a collaborative effort. The last CHA was completed in 2022, and we'll make sure to add a link to that in our chat. And the next will be in 2025. So our health department leadership is coordinating with our county hospitals to make sure that we renew this agreement for collaboration for our future CHA, so that we can continue to base the work of the coalition off of a data-driven process. We've also found, studies have found that a consultant-led CHA process with collaboration with local health departments is associated with a higher quality report. So we want to make sure that we're having the highest quality report possible. Something else that we're working on is application for Healthy People 2030 Champion Program. I'm sure everyone here is aware of Healthy People 2030, but the Champions Program is just a diverse array of public and private organizations that impact health outcomes at the state, tribal, and local level. All of the organizations that are part of the program are committed towards working towards a healthy people's overarching goals and objectives in their communities or service areas. So some of the benefits for us to complete the application for this program is we would get recognition on the Healthy People 2030 website. And then we'll get a digital badge that we can use on our website to really just give ourselves a pat on the back that we deserve. In addition to that, we'll get information, tools, and resources to promote the initiative among our networks. So how do we complete this program? To be a Healthy People 2030 champion, the organization has to demonstrate interest in, understanding of, and experience with disease prevention, health promotion, social determinants of health, health literacy, health disparities, health equity, or well-being. We do all of that within our coalition. We have a lot of our goals and objectives that we're going to go over today directly align with the goals and objectives of Healthy People 2030. So I don't think we'll have any problem getting in. Our next steps for this would just be the completion of the application. So as always, I'm looking for anyone that's interested in collaborating to help fill out this application. If you have ideas for how we might be eligible, I think this collaboration will probably look like one meeting, maybe two, where we just have an open discussion on how our goals and objectives meet this initiative, and then just have an editing team to go over any final changes before we submit. Most of the questions are short answer, 500 words or less. So it shouldn't be a big lift, but we want to do it collaboratively as always. So I would love to, if anyone is interested in collaborating on this, I'll put my email in the chat, or you're welcome to reach out to the PGHAC email address. And then I welcome Ms. Taylor Palmer to discuss our member rosters and responsibilities.
Thank you, Kim. Good evening, everyone. So another thing that we are working on internally, again, we really want to make sure that folks are at the table and to invite those who are not yet at the table. So to do so, we are rebuilding and updating the current coalition rosters for all of our work groups. So to do so, we are monitoring participation going back from the past year, and moving forward, we'll be monitoring participation and marking when folks are present. This will give us the opportunity to be able to reach out to folks who have been inactive, meaning that they have been participating in meetings less than once annually, and we will reach out to those folks to see if they would like to nominate another organizational representative to participate in the group, or if they would like to be removed from communication, just so we are not bothering them in their inbox. But a notification will be sent before this occurs. And as always, we want to make sure that we are being cognizant of who is in the group. So we are planning to add a new way for people to formally register or opt out of the coalition. So this will be coming through as a survey that we plan to regularly administer to stay on top of participation.
Thank you, Taylor. And back to you, Dr. Little.
Okay, now we're gonna go have our work groups give a presentation on where they are and next steps to really help some of the individuals on the call who have an interest in some of the work group activities and perhaps haven't gotten into one yet. This is your opportunity to learn more. So first up is our behavioral health advisory group, and we'll have a presentation from Margaret Fowler, who is the executive director of TLC Maryland, and Nina Ward, who is a public health program chief in the health department, and Carlos Mackel, who is the project manager with TLC Maryland. So you all take it away. I can't hear you, Margaret, yet.
They always turn that mic off on me. First of all, I'd like to just say good evening to everyone. And I loved the comments from Olo and Dr. Levy. It's music to my ears. And I'd like to just take a couple of minutes to just say that, you know, TLC has have a wonderful collaborative partnership with the Prince George's County government and building, you know, the Crisis Now best practices behavioral health model. And being first, Dr. Levy, we hope we're going to get you there, because we hope to have the first of its kind in the state of Maryland, the Crisis Now behavioral health model, as soon as we can get this crisis center built. So we have worked collaboratively again across all agencies within Prince George's County. And we also work synergistically with the Prevention Link group. So, you know, TLC has had that wonderful relationship. And I mention that because part of the advisory group for behavioral health in this first goal that I'd like to share with you is that we're going to promote integration between behavioral health and somatic care among the providers, the community programs, schools to access the emerging behavioral health needs in Prince George's County. We felt that, you know, it's a whole person. Sometimes we separate behavioral health and medical, but it's really looking at that whole person. Implementing the population health strategies to support integration of the behavioral health services into somatic care to increase screenings and acceleration of intervention, so that we know that we can get some of this into the provider's office. It doesn't have to be mental health providers. So we're looking again at the whole person. And one of the strategies there is to create a behavioral health continuum of care process and mapping dashboards. We're currently doing this with the emergency crisis continuum. But again, we want to continue to expand that crisis continuum to outside those walls of just emergency crisis. And then we want to identify the gaps and barriers to the behavioral health continuum of care. And the second objective is to collaborate with the state initiative and legislation to expand access to comprehensive behavioral health services. We are working currently now with the state to even build COMAR regs and rates for behavioral health services that are being introduced. So again, Prince George's County and this group will be instrumental in being making an impact for not only Prince George's County, but for the state. And then we want to address the youth behavioral health needs by participating in the promotion of the Maryland Consortium Hub and Spokes model in collaboration with the Prince George's County Public Schools and the Prince George's County Health Department. So we're trying to look at this in totality, and we like this spokes and wheels. So with that, this is our goal number one. I would now like to turn it over to my colleague, Carlos Mickle, to go over the next goal.
Yep, thanks, Margaret. Hello, everyone.
Hello. That's call and response, guys. We got to respond. Okay.
Good evening.
Hey, yep, thank you, Dr. Little. Yeah, so we're going to look at the third objective here, which is to reduce the stigma and discrimination associated with mental illness and substance use. Really important to focus on that. In addition to really stepping into developing a white paper defining current resources and evidence-based practices around harm reduction to reduce that opioid overdose fatalities that, is really troubling the country right now. And then to really get it out, we talked about awareness earlier. I heard that come up a few times. We really want to create a social media campaign to reduce the stigma around behavioral health and substance use / misuse, to address any barriers to implementation of best practices in Prince George's County. Margaret talked about best practice in that crisis now model. And then the fourth objective is to increase positive behavioral health screenings that result in actions, including referrals, and then accessing the types of and frequency of behavioral health screening tools, which is definitely something we want to focus on. And next, I'll pass it on to Nina.
Thank you, Carlos. Good evening, everyone. I was the resident new person until Dr. Levy started, and now he's got me beat by a few weeks, but I'm still going to claim my spot and just call out Margaret and Carlos for being great partners. I think this is our third call, Margaret, in 24 hours. And so I really appreciate all of the, Prince George's County, across all of our partners here today and more. All of the pieces are there for this crisis continuum, and with Margaret and Carlos's partnership, bringing it all together has been really critical. And so a really specific piece of that goal too is supporting the behavioral health needs of high-risk individuals and family networks. We have a couple of partners who are working in the space of high-risk individuals, and going back to Dr. Levy's point on the data, As we combine all of our data sets across partners for mutual clients, we're really able to get this clear picture of who our most high-risk individuals are, and case coordinate, case manage, and plan for effective results that, which is top goal always, but also reduces duplication across the work of so many different providers of a mutual client. So our objective here is to synergistically integrate programs and services in the continuum of care for high-risk individuals and their social support networks to prevent re-entry in the emergency crisis continuum through fostering those collaborative partnerships with existing groups and organizations in the county, and second, through identifying resources and missing spokes from that behavioral health advisory group. So going back to the hub and spoke model that Margaret talked about, we have the hub, and now we're trying to figure out what are the spokes that we have, foster that collaboration, and then where are spokes that are missing, where we need to engage new partners and bring them into the fold and really complete that whole person approach, covering all social determinants of health.
Yeah, and I would just like to add that, what TLC is trying to do with this also is building this data dashboard that will be given to the county once it's finished, that would be bringing from the entrance to a program through the whole output of outcomes for them. We'll be able to longitudinally track where people are, and then getting platforms where we can centralize the data collection so that it's interoperable. And so we're looking at, a couple of different platforms right now that would add to the mobile response team that we have. We'd have like a call center and a referral module, which again is going to encompass the other spokes that are going to be in this wheel, to be able to engage all the other providers and the behavioral health services as we do those warm handoffs as they leave the emergency crisis continuum.
Thank you so much. You all are doing some great work, and we're excited to be number one. We're not competitive. All right, we're going to move on to our health equity. And if there's some questions, you can put them in the chat. We'll try to have some time at the end if there are questions for the work groups. But please do put your questions in the chat. And if you show them to everyone, then one of the team members could perhaps respond to your questions in the chat. Okay, here we go. So our health equity group, work group is led by Phyllis and we're gonna get it wrong.
Zersacer.
Zersacer. And I should have saw she has, and this is so wonderful, but she puts how you pronounce her name in the chat. Anyway, so Zersacer and Phyllis, if you could present on what health equity work group is up to, that'll be awesome.
Sure, absolutely. Excuse me. Thank you so much, Dr. Little. Yes, ever since we started.
Sorry, I butchered your name.
No, it's okay. It's okay. Ever since we started Zoom, I found it, helpful to put the phonetic pronunciation in there. So practice as much as you can. It's not a problem.
I will.
So good evening, everyone. Again, my name is Zersacer Coyote. I am one of the co-chairs along with Dr. Phyllis Slade Martin for the Health Equity Work Group. Thank you so much again, Dr. Ola and Dr. Olo and Dr. Levy for your remarks this evening. And just wanted to shout out Kim. Thank you so much for, keeping us together and organized and on it. So just wanted to say thank you so much before moving into the presentation here. So it's really great that we're all talking about our goals and our objectives, because it's really also great to hear what all of the other work groups are working on, to see if there's any sort of collaboration and synergy that can be then created and fostered amongst the three work groups. So that's really great to hear. So I'll start off with the goal number 1 that we've been working on to promote and advocate for health equity for all individuals within Prince George's County. First objective, by 2026, enhance county leadership and stakeholder awareness of and preparedness to endorse policies targeting the fundamental drivers of health inequities. By December 2024, implement the Health Equity Champions curriculum to as many, it would be great, as many community residents that we could reach out to. Those are including service providers, leaders, and of course, like I said, residents within Prince George's County. Advocacy and policy influence to serve in an advisory role to the Board of Health by providing feedback on proposed and past legislation and programs. So essentially, you know, what we're really working on is the Health Equity Champions program, and that's mentioned in the goal here. And just really would like to take the time to also thank the University of Maryland Health Equity Think Tank, who've really tremendously worked on this curriculum with us, even down to inquiring about logistical details. So they've really been instrumental in carrying this work forward. And as we mentioned here, at enhancing our role as an advisory board to the Board of Health, because our voices, since you know we're in the community, matter, and it's good that we are in a position where we can lend our voices and our knowledge of what's going on to County Council, so that when legislation is being moved, that they are able to hear what's going on the ground, especially as it relates to health and all policies. And so we have objective 1.2, increase the reach and effectiveness of public health messaging to county residents, develop a comprehensive communication framework to broaden the reach of messages that increase public health resilience and address emerging public health issues. So goal number 2, we have here focusing on fostering inclusivity when it comes to healthcare opportunities and representation in Prince George's County, and the Health Equity Workgroup. So really building on enhancing a diverse workforce within the county, so creating and cultivating collaborative networks. So by December 2024, identify and establish partnerships with 12 key stakeholder or organizations who are engaged in work to address social determinants of health. And of course, that number 12 can increase by any means, but I think we wanted to start at a feasible number. Strategy 2.1.1, identify and establish partnerships with local community-based organizations that address social determinants of health, and implement a collaborative partner presentation series at monthly health equity workgroup meetings. So again, maintaining these partnerships, but not only in the healthcare spaces, right? Because we talked about health in all policies, but also in those organizations that work towards those goals of health in all policies. So building on collaborative partnerships with educational institutions, for example, enhancing those pipeline initiatives that are being created. And diverse workforce enhancement, enhance a diverse workforce in Prince George's County, healthcare roles, including clinical, administrative, and research positions, right? Because we want to, you know, enhance that cultural representation within our community that we serve. And again, like I said, expand involvement with local educational organizations and institutions. So we meet every third Thursday of the month from 3:30 to 5 p.m. And so we would love to have you if any of the information that you've said, that you've heard tonight resonates with you. Thank you.
Thank you so much, Sir Cesar. And congratulations on the curriculum. That was big. That's a heavy lift, I know. Our next work group Healthy Eating Active Living Group, and Anthony Nolan, the division chief at the Maryland National Capital Park and Planning Commission. And his chair is Jessica Moyes, and she's the vice president of Compact and Heart Association. So you all have the floor. I know Anthony's on. I saw him early.
Sure, or I can go on if I'm not sure. I can start. That's fine. Hi, everybody. Good evening. Thank you again. Thank you, Dr. Doolittle. Thank you, everybody. Jessica Moyes. And sure, I can just dive right on in. So this has been an ongoing conversation, I think, between on our HEAL committee, and I think this is definitely still ongoing, but some of the goals that we've really have been kind of diving into, especially under goal 1, is increasing access, obviously, to healthy living programs and resources that address the metabolic syndrome and obesity. So objective 1 is by 2025 is to increase the consumptions of fruits and vegetables in residents with chronic diseases. So we're looking at diabetes, hypertension, any type of any chronic diseases, as far as any cardiovascular disease, anything that we can look at that really dietary nutrition can really impact those residents in Prince George's County. So strategies including completing the evaluations of our Prince George's Fresh Pilot program. I'm not sure if everyone's familiar with that, but that's kind of really our food is medicine program that we've been working on for, I think the last couple of years. I'm in partnership with Giant Food, and really looking at how we can really work with including Giant and working with also Workgroup to see how we can really make an impact on Prince George's County residents. And we're really influencing patient outcomes when we're incorporating fresh fruits and vegetables and seeing how those can make health outcomes, increasing health outcomes when we're looking at incorporating those in daily diets. And that would, I believe it was $80 a month was incorporated in those residents to see if any type of, and we did see some beneficial changes when we saw that they were incorporated that into their Giant bonus cards. And where they were able to purchase those items in Giant Foods for those residents that qualified. We promoted the outcomes of Prince George's Fresh Pilot program. We identified additional funding opportunities for farmer produce prescription programs. We also looked at the evaluation and stakeholder feedback. We wanted to make sure that the program participants, that we looked at all the feedback and making sure that we made adjustments as needed for the program during the program and the evaluation component. The implemented education and food distribution, nutritional support program, including recommendations for food donations. So that's another area that we're really looking at. So we wanted to look at, when we're looking at food pantries, we want to make sure that the food that's being provided at food pantries is not just food that is for sustainability, but we want to make sure that it has a nutritional component. So we want to make sure that we're able to make sure that what the pantries are offering is not just nutritious. We want to make sure that it is something that's going to be able to sustain well-being for those residents, and not just providing them just a daily dietary intake, but also providing the nutritious well-being as well. The second objective is if we're looking to increase the proportion of residents who engage in regular physical activity. So along with some of us might be familiar with the Parks and Recs or expanded MNC PPC, a Healthy Minds, Healthy Bodies grant that was around. Anthony is on the line, so if you want to have a little bit more information on what that grant consisted of, he can definitely provide a little bit more information on that. But we want to see if we can extend that grant opportunity. And then we want to monitor and promote policies that increase access or address barriers to active living resources. That was the only, I think that might be, is that the only, I think that might be it before we go into the next slide.
Yes, unless Anthony wants to speak on the Healthy Minds, Healthy Bodies grant at all?
Thanks, Kim, and Jessica, thanks for stepping in.
Sure.
So the Healthy Minds, Healthy Bodies grant program, within Prince George's County, we serve, all residents, but within my division, we have therapeutic recreation, disability services, senior services, health and wellness, and youth services. This program is aimed at, originally was aimed at vets coming back from the Gulf Wars. And it's been expanded to any vet from any conflict. And the intent is to provide an opportunity for veterans to become reconnected and into society, civilian society. So this program provides a year-long free membership for the veteran who has at least a 10% disability, along with a companion. Can be a spouse, can be another vet, it can be anyone. It could be a child. And then they also get 15 sessions with a physical therapist that's trained specifically to work with veterans and their disabilities. This past year, coming out of COVID, we had a backlog of applications. And so we had about 160 veterans enroll in the program. Most of the offerings are at either one of the major fitness facilities, such as Fairland up in Laurel, Sports and Learning Center in Largo, and then the new center, SARC, Southern Area Aquatics and Recreational Complex in Brandywine. So, and again, if you have any information or you want to sign up, please let me know. With that said, on the next slide, the other major objective that we've been working on is to promote HEAL in county policy and zoning. So as part of this, objective 2.1 is by 2026, reduce the number of zip codes ranked as high need 4 or 5 on the Food Security Index. Now, as part of that, we worked to develop a map that would identify the number of healthy food providers within Prince George's County. This is supported by the Office of Information Technology, specifically the GIS office. And what the first round of producing the map was focused on grocery stores. So now they've been given permission to continue to expand that. So as part of this strategy 2.1.1 is to produce a healthy foods priority areas map utilizing updated data and healthy facility designation methodology. And this is tied to the next line, which is to promote the map with the Board of Health and community partners. So the new designation is going to take into account other providers, specifically restaurants. So as part of prepping for this meeting, I did pull up the layers located on PG Atlas, and if you're familiar with that, and it's one of the layers, and then it's points of interest. And I looked at the map for specifically for the area around the health department, and so I'll give you a couple of sites. The icon is a plate in a red placemat, and one of the closest ones is Wegmans. The other one is Prime International Foods, and then over off of Bright Seat Road. And of course, now I can't find the other one. Shoppers. Is it a Shoppers? Yeah, Shoppers Food over off of Largo Center Drive. What you will not see on here are, for example, the 7-Eleven over on Bright Seat Road, or the new Royal Farms off of St. Joseph's. Convenience stores were determined to not be healthy food outlets. They may have a mix of products, but really that's not their prime business. And then again, the important thing is to share this information, to identify areas that need additional assistance, and then provide some data that the advocates for local policies can support healthier food access in those areas. Being able to allow local politicians, local residents, other groups such as the Food Equity Council to be able to look at it in a truly data-driven environment and be able to identify those areas. And with that, I'll turn it back over to Kim and Dr. Little.
Thank you so much. So much information, good information. Now we're going to move into the community care coordination team relaunch. This will be led by Dr. Carter.
Thank you. I really appreciate that, Dr. Little. And I really want to try to get people energized around our CCCT relaunch because of the importance of it and because it does have a history. If you go to the next slide, I was so grateful that the director of the Health Action Coalition, along with the co-chairs, agreed to formally reintroduce the CCCT and to introduce it into the Prince George's County Health Action Coalition as a working group, because this was a large organization. It still is. It's just on hiatus, but it was an organization that really would help us move our population health forward. And I think it goes across all of the other work groups and can help all the other work groups. And it is a natural place for it. So I'm really encouraged by that. I am going to chair that along with Elizabeth Buchanan is going to help facilitate it. It's going to take a little bit of work to reactivate everybody. If you go to the next slide, because we went on hiatus because of, as you all well know, the pandemic. And there was, if you know about the CCCT, it had almost 300 members, and we wouldn't be able to get all of them together even when we had all 300 members. But when the pandemic hit, it was really difficult for us to do all that. And the members came from fire EMS, it came from social services, people, all of the stakeholders that played a significant role in coordinating care were at the table, and they played a really significant role. Now you may ask, well, how did it actually come about? Well, the reason we formed the community, the CCCT, was because when we looked at our community, we knew that there were folks who had a significant burden to bear with either they had multiple disease, they had multiple conditions, plus they had a lot of social determinants. And one of the things that was a significant burden was on our emergency rooms and the hospitalizations. So when we looked and said, how are we going to address this? How are we going to help these people? We knew that we had to help them coordinate their care because they didn't self-coordinate very well. And we were looking at that time at, how are we going to leverage community health workers to help people do that? And how is that really going to go about? And what kind of policies do we need, et cetera? And we realized that we needed to have a sort of a community of practice of all of the stakeholders, people who had a stake in making sure that people could get from where they are to a better and improved state of care. And we felt that would help us decrease how people overutilize the emergency room and decrease hospitalizations. And it turned out that was true. So the CCCT actually had a significant impact on how we were able to help folks with their social determinants, help people with their medication therapy management, get people into behavioral health, connect them to PCP, And all of that turns out to be the way you really have to attack a community. That's the wrong word. Well, you have to attack the disparities that social determinants cause in a community, and the way, and with in addition to health literacy, we know we can overcome a lot of disparities in the community if we just really focus on how we coordinate folks' care. So where we left off is that we were looking at the ways, the tasks that have to be done to get a person from one state to another state, if they were homeless or if they had behavioral health needs, et cetera. We were looking at, well, what has to happen between all the stakeholders in order to get a person to a better state? And what kind of data do we need to have in front of us, real-time data, to be able to make real-time decisions so that people can get from where they are, which could be, they could have a state of food insecurity, or they could be homeless, or they could not know how to manage their disease well, or their medications. How do we get them from where they are right now to a point where we were able to coordinate their care and address those problems? Now, that is exactly where what the CCCT does. It's a community of practice that's looking at the best practices that help our community, people who, especially the ones who have are at risk and have high needs, to get to that point. So so without going into a whole lot of detail, we really did take a whole person's approach. We really were looking at the people who had the greatest needs after doing stratifying the risk. And I believe that the community, the CCCT is one of those tools that the Health Action Coalition can use to better each one of your working groups to get to the desired outcome. So that's why this CCCT continues to be very important. We want to be sure that, and I want to be sure that we can activate it back so that we can take a deep look at the social determinants of health, so that we can be sure that it's really important that we help people with access to care so that they don't overutilize the emergency room. We really want to also be sure that we address the disparities issues that plague the entire nation, but in particular our county. If you go to the next slide. So we know for a fact that we don't have the providers in our county like when you compare us to Maryland or you compare us to the United States. We don't have the number of providers that we need. And we know then that we have to be very efficient in how we get people into care. And we have to use technologies and other ways of increasing that efficiency to be able to maximize our care. Because we're in a situation in Prince George's County where, and this has been true since I've been there, that we can't get as many providers in as we'd like. So that's why we have to be sure we can help people and coordinate their care as best we can so that we can optimize their care. Go to the next slide, please. So what is the vision of the CCCT? Well, the vision of the CCCT is to make Prince George's County a place where everybody has access to high quality care, where we have effective services, and they are well managed services, and they're tailored to our population specific needs. And our mission is to empower healthier lives through efficient care coordination and with a strategic systems approach. And this Health Action Coalition will help the CCCT meet this mission. And I'm really excited about it, because when you look at the CCCT, it is going to do everything it can to create those best practices that can affect the overcoming some of the social determinants of health and some of the behavioral issues, as well as some of the the behavioral issues and some of the even help with some of the clinical issues that will help people get to better care. You go to the next slide, please. So let me just say that we're going to relaunch the CCCT. It's going to be our first meeting the relaunch meeting is going to be on Thursday, September 28th. It's going to be at 11 a.m. And I would love for for everybody who believes that they are a stakeholder in people's care coordination to be there. We're going to try to get everybody who used to be there and get some new members too, so that we can make some real progress. So I think that sums up what I wanted to say. I hope I didn't talk too long, but that's part of my MO, as you all well know. So I'm going to end it right there and hand it back over to Kim. I'm going over to Stacy. I'm sorry. Back over to Dr.
No, you were handing it over to Kim. You were
okay,
right.
well, I hand it back over to Kim.
Thanks, Dr. Carter. I just want to note there is a typo on the slide. It's September 28th, as Dr. Carter said. And we will put a link to, if you'd like to be added to the roster for CCCT, we will put a link to that roster in the chat. All right, next, we just have a couple of community updates to share on our end, and then we'll open it up to any additional community updates before we close out. So I just wanted to share that the health department is doing back to school flu and COVID vaccination clinics. More information about dates and locations. I know they have extended hours at their Cheverly site, but also some on-site clinics directly at community centers. And all of that information is available on the immunizations page on the health department website. We'll put a link in the chat, and these slides will also be available for everyone. The behavioral health group has already mentioned the Maryland Community Health Resources Commission consortium call for proposals, but we wanted to just highlight that these applications are due on October 11th, 2023. We have the email address for the consortium at the state side, but we also have a couple of local contact information if you want more information directly from our local behavioral health team. We can provide that. We also have the link to reach out for a letter of support directly from the Prince George's County Public School System, which is required for these applications. So we encourage everyone in the behavioral health system that is interested to apply for these funds. And I will open it up to the floor. If anyone else has any updates they would like to share.
Hi, Kim, this is Cynthia Bauer. Could I make an announcement?
Of course, yes.
Good to see everyone. I don't know. There I am. So I just wanted to make sure that everyone knows about an in-person meeting we're hosting in College Park on October 4th. This is the inaugural meeting of the Maryland Consumer Health Information Hub. And I know that those of you who have been part of this coalition for a while know that the hub is kind of a natural evolution of the health literacy activities that we've been doing, not only with Prince George's County, but with all of the LHICs across the state. We are looking forward to hosting you in person. This is a networking and information sharing and skill building activity for 4 hours from 11 a.m. to 3 p.m. We're going to be talking about language access, making communication plans for all these great products that you're developing. We're going to talk about some of the opportunities and challenges in terms of public information distribution. So we're really looking forward to seeing you all on October 4th, and you can register by going to the Horowitz Center website. We have a register button there. So thank you.
Thank you, Dr. Bauer. Does anyone else have announcements they'd like to share with the group? And just as a reminder, we also have our calendar on the coalition website where you can add links or flyers for any of your upcoming events or activities to share with the group. And if you send those directly to me or Ray Wallace, we can add them to the coalition's newsletter that comes out every other week. And I'm not hearing any other updates. Dr. Little, I'll send it to you to close it out.
I just want to say thank you so much for always and working voluntarily, you know, and we appreciate all of your efforts. Newcomers, know that we welcome you. If you have friends who you think would be interested in participating and they really care about the county and they're interested in improving the health outcomes of their neighbors and friends and families, please tell them about the coalition. We're happy to, inform them about the work that we're doing. We're excited about this year and we're looking to, improve health outcomes. County. That's why we're all here. So I just appreciate all of you and thank you so much and have a great, what's today? Tuesday evening week. Goodbye all.
Bye, everyone.
Thanks.
Bye. Have a great evening, everyone.
Thank you.
Thanks.
Kim, good night to you and your clones.
Thank you. Good night, everyone.